touches something, the person could have left it there. And someone may not be there, and another one comes and picks it from there. And that is why one of the best models that we have used to talk about is reservoir modeling. So which means it's not just about people, there are also a lot of reservoir entities that can contain the virus. So which means when we are moving it, we are moving entities, people and objects are where it can survive a certain period. But if you take it further, even after it has become a pandemic, the various efforts being made to flatten the curve are also proof of the power of data science in helping to make very proactive decisions. And the best case study, or some of the best case studies that we'll talk about, will be in Asia, and not necessarily China. If you look at Taiwan is just about 130 kilometers away from China, so it should be one of the most affected countries, because we look at travel patterns, a lot of flights between Taiwan and China. But as early as the second week of January, Taiwan has already aggregated its national health data and national immigration data. And it was using QR code tracking system to be able to identify people who may likely to have been infected. And of course, that allowed the country to be able to be effective contact tracing. Now let's go to Korea. Korea was another great example. Korea went the extra mile. Korea went as far as using CCTV footages, credit card usages, telephone usages to know who has been to where, so that contact tracing can be more scientific and be more effective. And of course, we've seen how these countries have effectively used data to flatten the curve and reduce the risk of this pandemic. So essentially, data has got a lot to play and its various extensions. And there's quite a lot of learning for us going forward as a country.
Yeah, I mean, it's nice to hear Blue Dot, what it did in terms of the data, the symmetry, the collection, and even being able to detect as early as December in Wuhan that something was in the offing in terms of disease, which has now become, of course, a pandemic. But looking at the data science Nigeria, you have been doing a lot of things in data analytics, doing hackathons, even looking at medicals. I mean, there have been several activities around the players, the people that you've had, looking at solutions around the healthcare. So if you can give us some overview of your activities this period and how this can really help our federal and state governments and our nation in this period, because Africa, like the World Health Organization, Director General Dr. Tedros Ghebreyesus says, we need strategy, we need to deploy innovation and technology to address this pandemic.
Okay, for us as data science, before I go into the specifics of some of the things we've done, I think I will start by picking some of the learnings that largely informed some of the effort that we have made at Data Science Nigeria, which is a knowledge community of AI practitioners and students across industry and academic community. One of the best learning we saw was the instances of what we call crowdsourcing in many parts of the world, what we call symptom tracker, where individuals willingly volunteer information around symptoms they are feeling, so that we can have a knowledge-based system that helps us to properly curate, organize likely symptoms and what is not the actual symptoms. Because when disease evolves, symptoms also tend to evolve. And there are also variability in different situations and different circumstances. So using the power of what we call data crowdsourcing, a lot of organizations were able to get a lot of symptoms from independent people, and you will understand that there might be variation based on genetic composition of people, whether in different areas. The second one has to do with the fact that there has been a lot of open data. One of the biggest being what we call CODI, led by White House and AI, that released data set as much as 47,000, which means for the first time, a lot of organizations in the world came together to share their best practices. And this is what happened. This is what happened in the period of crisis, where the data you sit on, either in epidemiology data, movement data, migration data, everybody brought it together. And this provided massive volume of information that people can work with. So we also leverage that. But of course, there are learnings, like in China, there was a China graph epidemic spread. It's a social graphing system that looks at network analysis, who went where, how, what frequency. And of course, the close contact detector, those kind of solution has largely informed our effort. So what have we done in Data Science Nigeria? One of the things we've done is information sharing, best practice sharing, being able to synthesize this information. Just a few days ago, we published an intensive report that compared COVID-19, SARS, and Ebola virus. They are all viruses. But what can we learn from them? What are the patterns? What are the commonalities? So we're looking at the fatality survival rate with a view to providing guidance on how we can pick the learning of the past and to be able to manage this, because there's a lot of learning from the past. I'm sure we're all familiar with SARS, because if we look at Taiwan, the preparedness of Taiwan as a country was based on its experience with SARS in 2003. I went to publish the paper, which was meant to provide guidance on how to pick the learning from the past to inform a robust strategy to managing COVID-19, especially knowing the spreading pattern of virus. So there's quite a lot of learning. And of course, the approach to contact tracing and the whole concept of national surveillance in a more proactive and all-inclusive manner. The second thing we have done is in the area of health services delivery. Now that we have to do a lot of quick fix health centers in terms of testing location, isolation centers, management centers, we need to, of course, accelerate a lot of our hospitals to be able to deliver them. But the question is, which hospital should we focus on? Which centers should we focus on? So we have used what we call geospatial data and social vulnerability index. So we look at where people are most vulnerable, where are the places where people are most vulnerable, areas where population density is very high, people are more clusters together. So we looked at areas where, there are more transportation activity happening, a lot of road networks, people are always moving, a lot of commercial activity. And we're able to use that to predict where the best location for health intervention. Two of our young researchers did an amazing work of putting that paper together. And this is a paper that has gone far and wide, which has informed a lot of interest around how government can be more proactive and be better ready in terms of a better scientific approach to knowing at a coordinate level where should an isolation center be, where should the test center be, based on the fact that we can accurately predict the areas where the disease is likely to be prevalent based on certain parameters, population, age, concentration of people, epidemiological trend, and those kind of things. And of course, we continue to sustain learning even in this challenging time by ensuring that we continue to get data. One of the work we're doing now has to do with misinformation, disinformation, and human analysis. Because to be very frank, sometimes information issue can actually be the biggest pandemic. Because when people are not being informed, you begin to hear people taking chloroquine, people taking palm oil, and all those kind of things. It can even be the biggest problem. And I'm sure you understand people, as soon as people start saying, I found a cure, we do not necessarily make effort to validate or verify sources. People just take everything hook, line, and sinker. So what we are also working on, we're doing an extensive research on what we call infodemics. All forms of messages that people received, either as WhatsApp, either as SMS, Facebook Messenger, emails, whether message, did they forward those message, what action did they take as a result of those messages, and what was the takeaway? So we are aggregating this, we're using what we call natural language processing. And that's the mechanism that allows us to understand linguistic, textual, pattern, topical reviews of messages, so that we're able to understand what are the dominant misinformation rumor, and to be able to establish the likely impact based on the response of people. Because I got this message, I did this. Because I got this message, I didn't do that. And to be able to build a model that can be very useful for policy making and can guide our information delivery channels on how to be more proactive in how to manage information so that we do not create a bigger epidemic from the wrong management of information, which is what the kind of thing I've seen lately. I'm sure you've seen a lot of pictures of people drinking some very funny things here and there and all those kind of things. Of course, those things were shared through peer-to-peer information. So it's important for us to understand the impact of those social networks in driving misinformation and rumors. So in addition to that, we've been doing a lot around learning because we believe that we must continue to raise the bar of learning by sharing a lot of best practice researches that are being done all over the world community on areas where there can be a lot of collaboration and focus. And that was why in the second week of April, we organized a COVID conference where we brought experts both from computing and epidemiological area. We brought Professor Eileen Enswese, who is a professor of epidemiological, computational epidemiology at Boston University, to be able to inform us on some of the emerging trends and patterns so that we can begin to localize those insights, begin to provide the right guidance. Of course, we're doing a lot of other things. Of course, when they are unveiled, we're going to see a lot of them. But for us, as a community, we feel very responsible to see how we can raise the bar in providing the relevant guidance on how we can flatten the curve while raising the bar in application of local best practices.
Well, quite huge.
Quite huge, Bayo. But again, I know that data science is nothing comes cheap or easy, so there's a cost. So in terms of funding and financing, because again, if we're going to do anything, whether from e-government to agriculture, industrialization, data and sciences or data sciences put together, we just need to lay our hands on using technology and modern way of doing things. So in terms of some of the things you have heard from the authorities since the pandemic started in Nigeria and the response by the government and the central banks in terms of funding support for hospitals, pharmaceuticals, hospitals, diagnostics, and all that. Are you looking at some funding for those who are in the business of data sciences? How do you think we can mainstream this? So not just in terms of providing funds for those who want to produce drugs, who's going to produce diagnostic equipment, but those who need to provide us the first line of intervention or knowledge or information, which is data. Because without data, you don't even know how many people you're producing face masks or gloves or whatever to start with. So data is the beginning and the end of everything. Because now we're counting dead bodies and the number of tested and non-tested people. But of course, we need to have used this data ab initio to even know the footprints. Yes. So what are your thoughts around this and how do you think we can mainstream this? And if you're going to point fingers, where is the role of the Ministry of Science and Technology in this conversation, please?
Thanks. I think I fully align with you. We must mainstream this. Like one of the leading management gurus said, whatever you cannot measure, you cannot manage. Measurement becomes a critical measure of success of what we've done. Either in surveillance, MPIs tracking, infection tracking, and even return on intervention. A lot of intervention has been done. What are the ROIs and all that? So definitely, but I'm aware there are a lot of monitoring and evaluation that have been done. But of course, we need general public because the data is pervasive. Different people in different locations are collecting data, and there must be a way we're able to aggregate this together. I'm aware a lot of intervention is being done with the Presidential Task Force, working with some of the organizations we are working with. A lot of development agencies are actually leading a lot, working with the Nigerian government in this regard. So the understanding of mainstreaming it is obvious, but how to standardize, upscale, and scale it up on a sustainable basis will be very critical. Because we must understand that the whole impact analysis is not necessarily at health level. There's always a cascade analysis. What is the economic implication of COVID-19? In all those cascade analysis, how many people are now out of job? You know, if you look at the recent data I saw from August, who's saying remittance to Nigeria declined by 20%. Yeah. And that is one of the biggest source of revenue for an average Nigerian who rely on their families in the diaspora. We must be able to substantiate those impacts. So this whole COVID-19 has a lot of multi-layered data points. So we must be able to build what I call the data value chain for COVID-19 beyond health to understand the socioeconomic implication, because we are a highly organically, dependent society where Mr. A depends on Mr. B, Mr. B depends on Mr. C, and all those dependency layers will begin to weaken as the impact of COVID-19 begin to affect available funds to family. Because the other thing you're going to see is that people will now begin to spend more money on their health and on food, and that has implications on other drivers of life. So essentially, the need to midstream, as you have said, is obvious, but it's not just for health. That's the point I'm making. It has to combine all the triggers and all the value drivers so that we're able to build a data nav center that brings to bear all the various data points that can help us make economic decisions around every single investment in flattening the curve. What is the direct impact on job created or lost? Direct impact on education, direct impact on economic value of our country, and of course the gross domestic product, the total value of goods and services we produce in our nation in a year. How can we establish the logic of the link? Because what that does is now to say, what are the other things that we have to do? Because when we're able to measure it, we see the gaps and begin to see what new areas we need to explore. Of course, digital, in as much as this is a bad story, there's some silver lining that we have seen. That truly, COVID-19 has also shown us some possibilities. Recently I saw an advert of a leading hospitality business based in VI of offering logistics and food delivery service. And also, I was surprised that, wow, this is an international hotel now offering logistics, food delivery, and, a lot of new services. So which means that we also need to begin to quantify new business opportunity that COVID-19 is throwing up. So that as much as we look at the negative, we also see the positive. And we're able to sum it together. And from the overall impact, we're able to see the positives that bring it all together. So the summary of this is indeed, we need a lot of data points. We must mainstream this, and it must, of course, be government-led. In terms of the role of government, I can say government has made no effort in this regard. A lot of science and technology institutes are pushing a lot around innovation. Data sharing has become a standard template. We've been part as Data Science Nigeria, a lot of data sharing intervention driven by the Ministry of Communication and Digital Economy, bringing together experts to see what we want. So a lot is actually taking place, which are not necessarily in public.
Okay, you say a lot has been taking place. But in terms of interventions and even trying to ensure that we can provide effective services to the people in the period of the pandemic and even post-pandemic as we begin to open the economy, data analytics, artificial intelligence, and even the use of issues like drones are very important in this time. We see in Chile, drones were used to deliver medical supplies and materials to the elderly, and even in Rwanda used drones to disinfect the city and provide services. So are we looking at the DSN and other stakeholders engaging government in that regard? And also adding to the fact that the vice president and some governors said one challenge they're trying to address is this data value chain that Mr. Bayo has mentioned. Data to even know how to reach out to the vulnerable and poor in distribution of palliatives. Data in effective planning, in knowing areas you can even distribute infrastructure that will support people in this period of social infrastructure.
Yes. If you take that, Bayo, and I'm looking at this pandemic, like we've had Ebola and the rest, I'm sure you will try to identify certain institutions or areas that would need to mainstream and deepen data sciences. For example, the Federal Airport Aviation Authority, FAN, for example, or NCAA, the customs, for example, the immigration.
Just Center for Disease Control.
These agencies that those who are in the cargo business and what have you. Again, if you're looking at, then those who are in logistics and transportation to be able to track who goes where, when, how, at the border posts, both land, sea, and air. How much of work is going on in this area in terms of interface with critical organizations such as yours in ensuring that, yes, we handled the Ebola well, we were lucky, then we're handling this, perhaps, and when another one comes, perhaps in our lifetime, perhaps not in our lifetime, that we are better prepared than we are in 2020 in terms of using data.
Okay. Yeah. Okay. I think for me, I will refer to a statement made by His Excellency, the Governor of Lagos State, Governor Sanwo-Olu, around the issue of identity. that the lowest common denominator in all these various data points is identifying people. Who moved to where, when, how, what frequency, how recent, what is the problem? The need to integrate our national identity has become a national emergency because all the countries have successfully done contact tracing and all that. I recall Minister of Health in one of his early press conference spoke about the fact that the addresses and provided by people when they came in, when they fill those papers, they are rushing to Nigeria and they give you paper to fill. People fill different things, Of course, we need a blockchain-driven system. In the UAE, there's something called Pass App, which has been successfully used at a time like this, where you are known and authentications were given, and you could have access to services, even certificates were given, even during COVID-19. People married during COVID-19 using UAE Pass App. Because all your identity are aggregated and of course stored in distributed ledger using the power of blockchain. So all these are things that should be a frontal conversation, and this conversation are not industry specific because it brings all of us together. It's a national identity, and for me, that should be our biggest conversation going forward, because that is the biggest entity that across all spectrum, and that gives the ability to be able to track. Let me give you a simple example. As soon as the lockdown was lifted and people moved out, I'm sure you saw the picture of what happened on Monday.
Yes.
People rushed to bank. I was very keen on it, and I wanted to know why people went to bank. One of the reasons I discovered was that people were saying that their cards, their card expired within the 5 to 6 weeks period. And you can understand that an average card has a lifespan of about 3 years. So if there's no activity for 1 month, we can assume that 1 out of 24 of the people who has a credit or debit card will expire. So they needed their card so that they can use it as form of ATM. These are authentication that will have been done via the blockchain distributed ledger system. Which also has implications not just on people, even on supply chain. Recently, I think 3 days ago, World Economic Forum in Nice took it effectively using blockchain for supply chain management and ensuring what we call shared trust is institutionalized for transparency. So these are systems that we need to start talking about. Identity that is universal. As in Nigeria, you have an identity that is consistent across all data points, all data value chains, which will be useful to manage the vulnerable. Social interpretation can be more strategic, can be more focused. And of course, development can be more meaningful. Effort of developmental agents can also be channeled based on the fact that they are informed about the relevant data. And of course, blockchain also comes in such that those information and identity are applicable in critical areas like health, where data must be preserved on a consistent basis and on a trusted platform for a long period of time without any form of security leakages. So for me, identity, distributed computing or storage system are things we need to start looking at, which takes us across all value chain. And I think this must be a national priority, as this has been raised by government officials and of course by the private sector. If they're able to knock it at this point, I will have solved 99% of the problem. The next thing will now be about delivery, deployment, and return on intervention, because the baseline of the foundation has been built.
Wow. I mean, if I'm taking what you're saying, Mr. Bayo, that means even for the Economic Sustainability Committee, part of the plan, that integrating the plan that they have should be national identity, should be a very core strategy to ensure that we harmonize from BVN, from passports, even down to the
yes, because again, that's a very crucial point. When people are coming in or getting employment or getting other things, people have the tendency, more often than not, to fill wrong information, deliberately, whether to hide things or they're not, whatever it was. I'm not too sure it's all about illiteracy. And I go back to the case of the airports, for example. If you go to Murtala Mohammed or any of the airports, you find a lot of people hanging around. They want to help you carry your bag. They're wearing some ID cards that you can either verify whether they belong to FAN or they belong to any airline or they belong to what services. They are handling bags and luggages. They are hustling for what you call their daily bread. they call them touts, whatever they are. They want to help you get a ticket, help you get a trolley and things like that. Then as soon as you get to the car park or whatever, you have another retinue of people. So, and these are people who touch your luggages, for example. They touch everybody's luggages. They are the folks who work within the airports and all of that. Some of them clean the aircrafts or whatever it is. So are we sure that we have data, adequate data of where these folks live, where they live, their residences, I mean, are they all everyone well captured, for example? If you go to the seaports, it's almost the same thing. So in terms of economic sustainability and moving forward, if we look at the financial services industry, yes, we've done very well with data, and we can still do a lot better. But when it comes to government, we need our government services in terms of knowing how many workers do you really have, or that goes into a Alasa Secretariat on a typical day, for example, here in Lagos, for example. How do we know? Because it's just a free info. How many do we know? Apart from, yes, the governor can say I have 1,000 or 10,000 people on my workforce payroll, but if I have another 10 or 20,000 there every day, how do we ensure that they are not spreading anything? Now, because we're scared of allowing certain level of workers go to government to resume work because we're not too sure. Okay, because as soon as they resume work, they will have to deal with the bubbles of the public. I want to renew my tenement rate. I want to pay for this, and I want to perfect certain contracts and what have you. So it's all going to be all work, but we cannot continue to lock down government in perpetuity. So, and I'm sure the government will be trying to find a way around how to ensure that the pandemic is not, the virus is not well spread when the mainstream civil servants or public servants get back to work. Bayo, any idea for us how we can handle this?
Well, like I've said, the way I would say it is, in as much as there's a problem, there seems to be some big bang solution, that can just help us to address this. Like I said, if we can fix issue of identity, information sharing, and the whole concept of open data or open data ecosystem, where data that are held in different places are brought together. I will use an example of one of the data that Data Science Nigeria team used. It was a data called Grid data. Grid data, GRID3 data, is a data that has mapped every point of interest in Nigeria at world level. So all the ATMs, all the banks, all the hospitals have been mapped at the coordinate level. Schools have been mapped, primary, secondary school. So if there's a problem in location A, I can determine how many people will be affected, because the data point has also helped to map how many houses are available at 1 kilometer by 1 kilometer level. What they have used for the work is actually satellite data and microsensors. And they're able to say there are 50 houses here, at the average of 5 people per household, there are 2 people living here. So if there's a problem in point A, and if point A is about 5 kilometers away from this settlement, these are the likely number of people that will be affected. So this data has been made open by Bill and Melinda Gates Foundation and USAID through their partner, Flowminder, based in the UK. So those things exist, and I believe that there are no other interventions. But one of the things that must happen, that's why I've said that let's see the silver lining. As we flatten the curve, let's also see that we are also flattening data access. We also provide a level playing ground for everyone to come to table with data. Because that is going to be the ultimate game changer for the future. Of course, we that are experts also have the responsibility to make this thing as simple as possible. We shouldn't make it buzzwords, we should not use it to intimidate people. When people come and it's all about buzzword terminologies, let's make it as simple and understandable as possible.
Yes.
So that all the various little interventions from World Bank, because when people use some of the terminologies and complex languages, it becomes really difficult for us to be able to bring all this together. I think one of the things that is very clear is that data is the ultimate game changer for us. So as a nation, there must be a data value chain agenda that brings both private and public sector together. And the return must also be clear. And for me, from an economic perspective, we must be able to also establish, if we know everybody, what is the return on intervention, return on knowledge of all Nigerians? From tax perspective, from planning perspective. There are Nigerians who are doing so many things in different areas that are not aggregated. BVN has shown us a lot of possibilities. What of you were able to map BVN with travel history, with your educational level? Imagine the quantum of information available. So for me, looking at the clarity of the final outcome of how data can accelerate development, accelerate sustainable growth, we should focus on sustainable, high-scale application of data. And that, for me, is the kind of narrative that platforms like ProShare to help us raise. That there is an urgency, there's a national data urgency, not as an academic intervention, but as a lever for sustainable socioeconomic development of our country. Because I also need to mention again and again, in as much as there's a challenge to the economy as a result of COVID-19, new opportunities are opening up. If we're able to get the data and we know those areas, we can invest time and resources in those areas and see how we're able to expand those opportunities while picking the lines to support the areas where we've seen it. So this moment is a moment of reflection. It's a moment of thinking and looking backward and asking ourselves, let's do things that will position us for the long term and not just a short term, let's fix COVID-19. It's about 15 institutional problems around identity, distributed data, and data-led intervention that makes every system accountable, share trust, transparency, openness, and accountable governance that makes everybody make data work. Because, like I said, structured data, it will tell you anything you want to hear. So, which means that data must be treated well. And that, for me, is one of the big takeaways for me for a time like this.
Yes, few minutes closing word.
3 minutes closing word. Well, I just want to say that we're just getting breaking news that the President Buhari has appointed, restructured the board of Nigeria Bulk Electricity Trading PLC, NBET.
In the power sector.
Yes, in the power sector. The finance minister, Zainab Ahmed, is now the chairman of the board of NBET. Okay. This looks like the government is...
huge responsibility for her. She coordinates finance, budget, and national plan.
Now, she's the chairman. She's just been appointed. This is from the Twitter from the presidency. Yeah. Zainab, Nigeria's finance minister, is now the chairman of the board of directors of NBET PLC. Then a non-executive director from the Ministry of Power, to be represented by a director, someone in the staff, no less than a director. Yeah. Then, of course, Alex Oko, who is the DG of private,
yes, public
enterprises. Yes, because the BP is also 80% shareholder in NBET, so it's largely a government enterprise. I think this major move by the presidency means that the IMF facility of $3.4 billion, which is being disbursed to the country, has some is a carrot that has some I don't want to call it stick, but has some conditions attached. And if they talk on social media that yes, Nigeria promised the IMF that will pay more for electricity, I think the government is now taking steps to actually restructure the power sector. Again, there's been so much talk about NBET, how we can fund it more. I know NBET is being supported by the AFDB, the African Development Bank, and there's still a lot more that can be done. But this looks like the government is now taking the entire power sector more seriously, appointing Zainab Ahmed, the finance minister, as the chairman of the board of NBET. I'm sure Bayo would not mind to see a rapid improvement, because how do you do data sciences if you're going to be powering all this
infrastructure?
With generators? It just messed up your millions of dollars of investments in those equipment.
And an effective data management is also key to improve.
Yeah, because if you are going to say, well, you have to thumbprint or do whatever, or you do capture someone, and there is no light. Now we have about 6 lights in these studios or more, and that's how you can do effective web streaming. If without that, without it, what do you do? So if you go to the airport or elsewhere in offices, and you said folks should sign in by using their thumbprint, and the system does not work because there's no electricity. And the generator is not working because the guys who are repairing it are not yet there. Or the diesel company is here to bring in diesel. What do you do? So we can't get the whole data sciences and everything done if we don't improve fast and quick on electricity. We're just winking. We're just winking we're just winking at ourselves in the dark. I don't know what you're saying, Otto. maybe Bayo can see you, but maybe.
Yeah. Thank you very much. Thank you very much, Mr. Bayo Adekanmbi, for the conversations. I mean, the biggest takeaway is that we must go on a sustainable, high-level data asymmetry, identity management, which is key for transforming our economy, particularly the digital economy, which is key at this time of the fourth industrial revolution, COVID-19 pandemic, post-COVID-19 pandemic, very key for Nigeria. Thank you very much, Mr. Bayo Adekanmbi, founder of Data Science Nigeria, for joining us.
It's a pleasure to join you. Thanks so much. Do have a great morning.
Yes. And thank you so much, Mr. Bolson, CEO of Africa Reports. Particularly, we did see that very good breaking news, which will sustain.
Interesting. You'll be surprised. The former Director General, the Chairman of SEC, Suleiman Danusa, is now also on the board of NBET now. So that means everybody. I think the government wants to do. I think something is going on down here. If you have the finance minister and a former SEC chairman and former DG there, I think the government is going to the market, or the DG of BP. I think something is going on.
And it's advocacy coming from
something big is going down in the power sector. Maybe it's time we sell the discourse on the market. I don't mind.
That would be a big one.
I need power.
That means that
No, I'm not going to miss that. We just need to power the market.
Yes, definitely. So that was a conversation today on the market review, looking at COVID-19, fourth industrial revolution, implications for Nigeria, and we had Mr. Bayo Adekanmbi, founder of Data Science Nigeria, giving insights on how data science analytics and things like artificial intelligence can help support our fight against the pandemic and even post-pandemic era. Of course, data asymmetry, identity management will be very key in addressing issues like this for Nigeria. And of course, we had Mr. Bolson Omofaye, CEO of Frontier Africa Reports, also giving us a market and economic perspective to data technology and, of course, the impact it will have on our economy. So that's all for today's edition of Market Review. Log on to our website, www.proshareng.com/COVID-19, to get all the updates you need on the COVID pandemic and its implications for an economy. And also log on to our website, www.proshareng.com, to get our news stories, market analysis, and reports. You don't want to miss reading and learning about the economy and market this period. Till we come your way again, thank you for watching. Have a nice day and stay safe.